Hello, I'm going to be talking about what we learned over the course of the semester in educating exceptional students. So we covered 10 disorders, and there are 13, but the 10 we covered were emotional disturbance, ADHD, learning disabilities, communication impairment, intellectual disabilities, autism, vision, hearing, giftedness, and TBI. So first I'm going to start with emotional disorders. Signs of these include inability to learn that can't be explained by intellectual, sensory, or health factors. A lot of the times it will be inappropriate types of behavior during class, just kind of outbursts, or unable to really have relationships with peers or the teachers. This also may include schizophrenia, but that's not usually common among young kids, but it could be the case. And so when you're trying to help in the classroom and figure out ways to help that individual, it's important to really get to know their attitude and their best ways to learn. And so allowing different responses other than verbal is a good way to do this, because if they don't want to speak in class or participate by speaking to others, it's nice for them to be able to, use note cards or use notes and then give that to you at the end of class, so you know that they were in fact, paying attention and learning, but they are not, stressed about having to talk in class, or if they're just not feeling, like themselves, or they're feeling depressed, it's a lot easier for them to just do something like that. It's also important to let them know that you are available to them. Even though you are teaching, you're available at all times. If they need you to talk about something, or need your help with something, if they don't feel comfortable, that you are there to help them. And so our next disorder we have is ADHD. There's a lot of characteristics that come along with this, and it's easy to kind of, pick them out. And so it's easy to identify children who have ADHD early on. They're easily distracted. It's hard for them to follow directions or finish tasks. You can tell them to clean something up, and then, 2 minutes later you look and they're completely off task. They are daydreaming often. They can't really stay seated. They fidget or bounce, when they're sitting. That they have a lot of impulsivity. And a good way to help is using the sticky note method that we talked about in class. And that's ripping apart, 3 tabs of a sticky note and sticking it on their desk, and then saying, each time you're disruptive, or I think that you don't deserve one of your stickies, I'm going to take one away. And then using like a reward system to be able to let them feel like they accomplished something that day. There's also different seating you could try, like different chairs, with a ball on it, so that they can kind of wiggle around, or, taping a square on their on the ground around their desk and being like, you have to stay within this square, but I don't care, if you need to move around or, wiggle, just stay within your little area right there. That's a good way to also let them know that you know that they have trouble staying still, and you are allowing them to move around a little bit. Now we're on to LDs, learning disabilities. The most prevalent of all disabilities is learning disabilities. 36% of all students with disabilities have a learning disability, and boys are 2 times more likely than girls to have a learning disability. And our teacher has talked about that's kind of prevalent when you get to a classroom, because you kind of see that, boys struggle a little more with this. And there's no typical student with a learning disability. They're all, kind of different. And examples of learning disabilities, struggling with memory, a reading disability, like a math disability, or social and emotional needs. So a way to help this is breaking learning into steps and using diagrams, so that these students, can take learning one step at a time and see it just compared on paper, and just really allowing them to take it step by step. The next impairment that we're going to talk about is communication impairment. This adversely affects the child's ability to talk, understand, read, and write. Examples of these are mixed receptive expressive language delay, phonological delay, articulation disorders, fluency disorders, voice disorders, and stuttering. These are also pretty prevalent when you're, talking to children or students, and they're easy to identify pretty early on. It can affect how willing a student is to speak in front of others or in the classroom, and so it's important to, let them practice their speech and get in with a speech pathologist as soon as possible. Encouragement is key with these students, and a way to help them is with assistive technology, especially apps on a tablet that can help with pronunciation and reading and writing. I think that it really can help with their encouragement and also their willingness to really talk in front of groups or be in groups, because having that assistive technology can really help them really, sound out words and mimic words or sounds or letters. Intellectual disabilities. So the most talked about one is Down syndrome. So we really talked about erasing the R word, and I think that's really important, and I think that will be a very prominent thing to teach in the classroom, because I don't want that word in my future classroom, and I don't think anybody really needs to use it. So adaptive behavior is how they learn to do tasks. So conceptual skills, social skills, practical skills, basically daily living skills, reading, writing, language, occupational skills. And to help these students is best by using step-by-step learning. Repetitive teaching and learning is key to help these students really learn how to do daily tasks. And they are capable of learning these tasks. It just, takes a little more time and really focusing on one step at a time and taking time to learn those steps. Autism is what we'll talk about next. Children with autism are distracted very easily. They can have obsessions over certain things like hobbies or stats or objects. The spectrum is low to high. There's low functioning and high functioning. And low functioning are students who can't really communicate. They have trouble listening. They travel at their own pace, and it's kind of, their terms. And learning can be difficult for a teacher because they feel like, frustrated, but taking the task at their pace is kind of the way to do it and the way to go. And then high functioning students with autism, they can communicate. They're able to participate in class. They have troubles with certain subjects, but really, they could seem pretty able to function on a daily basis. It's just trying not to overstimulate them. And no two cases are the same. The best people to talk to about autism is, that child's parents, because they're the ones who know them best and know how to handle, if they have a meltdown or something like that. So it's important to get their input and use that in the classroom. So ways to help them in the classroom, keep things simple. One-on-one really helps, because otherwise, they could be overstimulated. So another thing to remember is to not overstimulate that student, because otherwise they get really overwhelmed and it can cause a meltdown. Next, we talked about vision, and there are many types of visual impairments. Parts of the eye or brain that are needed to process images become diseased or damaged, causing either severe or total loss of vision. Visual impairment is a term experts use to describe any kind of vision loss. So whether it be a person who can't see at all or someone who has partial vision loss, they can be under visual impairment. Legal blindness is when one has lost enough vision that they'd have to stand 20 feet away from an object, to someone with perfect vision who could stand 200 feet to see the same object. So a way to help that student in class is magnified worksheets, letters, or words. And what's nice is using technology to do that, because then you can, blow up pictures, or like we talked about in class, blowing up students' music. And so they're able to, participate in band because their notes are kind of amplified, and so that they can see them. Next, we talked about hearing. This occurs mostly at or right after birth. Hearing loss does. It can be caused by exposure to loud noise, which can cause noise-induced hearing loss. Students can acquire speech reading. It's important to start early intervention with those who have hearing loss, because then they can start learning, ASL and speech reading right off the bat. ASL plays a large part in hearing loss and deafness. Cochlear implants also, and hearing aids, they help students hear in class. We talked a lot about those and the ways that we can help these students, using amplification systems in the classroom, like using microphone. A teacher who uses a microphone or an interpreter, it's important for them to really, understand that the student is learning. Also using different tools that allow the student to see everything happening as the teacher speaks, and also being able to read their lips, just like we talked about in class, using a projector, so using what the kids can see, like an Elmo, using it, the kid can see you talking as it's projected up onto the board. We also then talked about gifted students. Students that are gifted have an above average IQ and are well above their grade level. Some students may be gifted in certain subjects, but struggle in others. Oftentimes, those who are gifted have trouble interacting socially. And giftedness is usually detected very, very early on in education. Ways to help these students offer most difficult problems first and teach to their interests, so that you can really pique their learning and willingness to go above and beyond. So our last subject we talked about was TBI, traumatic brain injury. Often these are the result of a sports accident or a car accident, and they're most commonly from falls. Symptoms of these are confusion, blurry vision, concentration difficulty, and treatment typically is just rest, but it can be as severe as medication or sometimes even surgery. If TBI occurs when the individual is an infant, it can severely affect their progression into childhood and adulthood. And it's important to allow processing time for those with TBI in the classroom, because they'll need extra work time to understand assignments or tests. And you can kind of tell, when you're teaching, that their processing time is a little slower. So ways to help them in the classroom is having peer note takers, or providing assignments in writing so that they already have that assignment and that they can read it at their own pace instead of, trying to keep up when you're talking to the rest of the class. It's also important that they can sit next to the teacher, so if they have questions, they can quickly ask them, just sitting right there, raising their hand and asking. So, we learned a lot this semester, and I'm very thankful that we had Mrs. Musil as a teacher, because she really helped us have hands-on interactions and to put ourselves in those with disabilities or disorders in their shoes, and really learn how to interact with these students and help them, and just really focus on including everyone in the class. So, thank you.